Hi everyone, and good evening, and welcome to another Plant-Based Health Professionals UK webinar. Just going to give everyone a second to log on this evening, and then we're going to kick off with the webinar for this evening on a review of evidence-based nutrition practice in 2023 rather. Okay, I think we'll get started. So good evening, everyone, and welcome to another CPD accredited webinar. These webinar series have now been running for 2 years, and we're going to be joined again by Dr. Shireen Kassam, founder and director of Plant-Based Health Professionals UK, who I'm sure needs no introduction, to discuss evidence-based nutrition practice in 2023 this evening. Before we get started, for those of you who don't know me, my name is Rahini Bajakal, and I'm the communications lead for Plant-Based Health Professionals UK, which is an organisation dedicated to promoting the health benefits of a whole food plant-based diet, the prevention, management and treatment of common chronic illnesses. We're going to be joined by Dr. Hannah Short, who's a GP specialist in menopause, premature ovarian insufficiency and premenstrual disorders, and the co-author of the Complete Guide to POI and Early Menopause on the 8th of March for a discussion about nutrition and lifestyle factors and POI and early menopause, which affects around 5% of women or those assigned female at birth under the age of 45. This conversation is going to be so invaluable for anyone who wants to learn more about the menopause and empower themselves with evidence-based information, as well as those who want to support those in their life going through this difficult condition, but as well as anyone who's going through the perimenopause or menopause in general and would like to learn more. We're grateful to be supported by veganfitness.com, who kindly lend us their Zoom platform, and be CPD accredited by the British Society of Lifestyle Medicine and the American College of Lifestyle Medicine. You will receive your CPD certificate in your inbox in a few days' time, and the recording of this webinar will also be available to all PBHP members via our members area again in a few days, and everyone who's attending will also receive a copy of the presentation slides. And lastly, a reminder to support our work if possible. Do consider joining us as a member. This is open to everyone around the world, and I happen to know that we have several people joining from Australia this evening. So we have members all across the globe, and everyone is really welcome to participate. We also have a closed Facebook group, which is really active with daily posts and conversations all about plant-based nutrition and lifestyle medicine. And you can also visit pbhp.uk to subscribe to our newsletters, or consider donating. Even £5 helps us run this webinar programme via pbhp.uk/donate. We're also active on social media on Facebook, Instagram and Twitter, where you can keep up with our latest work. And now, without further ado, I'd like to welcome Dr. Shireen Kassam, who is a consultant haematologist, board-certified lifestyle medicine physician and visiting professor of plant-based nutrition at Winchester University, and obviously founder and director of PBHP UK. And Shireen's also going to mention the 2 books that she helped write and produce last year at the end of the presentation. We're going to be joined with by Shireen with a live Q&A at the end of the session. So at any point, if you've got questions, then pop them in the Q&A box at the bottom of the chat so that I can put them to Shireen at the end of the talk. And we're going to be wrapping up around 8 o'clock. So over to you, Shireen.
Great, thanks very much, Rahini, and thanks everyone for attending. I seem to make an annual appearance at the webinar programme, so it's great to be back in 2023, top of the year, to hopefully bring you up to date on what's current and what we are awaiting for further research in the coming year. What I hope to cover today in about 40-45 minutes is a consensus on diet, nutrition and health, what we know currently, some areas of nutrition controversies, and areas of active research where the next few years will produce some interesting results, I'm sure. So just to set the scene, sadly, things are only getting worse. And I think every time I present on this, the stats are more and more depressing. But the latest data tell us that unhealthy diets are responsible for around 1 in 4 deaths globally. That's virtually every single country that's been studied. In Europe and in the UK, premature deaths, that's below the age of 70 years, around 1/3 of these deaths are associated with an unhealthy diet. And at the same time, our food system in its entirety is creating 35% of all greenhouse gas emissions. And of course, we know it's not just about greenhouse gas emissions. Animal agriculture is the major driver of biodiversity loss, ocean acidification, land and water pollution, and the list goes on really. So our food system is neither good for human health or planetary health. And the latest Global Nutrition Report, if you haven't caught it, out in December, states that all forms of malnutrition, that's hunger to obesity, have increased everywhere. And most countries have this sort of twin pandemic, as it were, of food insecurity and obesity. And wherever you look in the world, every country, continent is not consuming enough of the healthy food. So we know that diets are unhealthy because they are too low in fruits, vegetables, whole grains, nuts, beans, and seeds. And you can see here that these major risk factors, wherever you are in the world, we're not meeting the minimal recommendations. And so all of these numbers are negative, and that's continued over this time period of 2010 to 2018. And in the UK, we are suffering from this cost of living crisis, where the poor have got poorer, the richer have got richer, and these disparities in health outcomes have widened. So these are just some headline messages from the report that's produced every year by the Food Foundation called The Broken Plate. These stats are fairly shocking, really, that the poorest fifth of UK households need to spend nearly 50% of their disposable income just to meet the UK government recommended healthy diet, that's the Eat Well guide. And this is compared to only needing to spend 11% of their income for the richest fifth. And diet and unhealthy lifestyles and other socioeconomic factors are leading to greater disparities in healthy life expectancy. So those are the years lived in good health. And in general, the most deprived tenth of the population spend 20 years less and 18 years less in good health compared to the least deprived, so longer in ill health if you are of lower socioeconomic means. And at the same time, if the food system in the UK continues as it is, it will be producing emissions that are 4 times higher than the level that is needed for the UK to meet its net zero target. So we're way off course. But what's been clear for several decades now are that the core components of a healthy diet are ones that are centered around healthy plant foods. Now, if you haven't seen this review from 2020, it's quite a good one, and it includes a researcher and a nutrition expert from the University of Southampton. And this summarizes where we are and where we have been for a long time. And it's interesting that all healthy dietary guidelines, the pyramids at the base, really start with all the other important lifestyle factors: physical activity, social interaction, adequate sleep. That's the core of lifestyle medicine. But equally important is what we are consuming on a daily basis. It should be mainly water for thirst, teas and coffees are fine, fruits, vegetables, whole grains, beans, nuts and seeds, and olives and olive oil if you enjoy and like using it. And everything else is optional and less frequent. So it's interesting that this pyramid is also optional in daily fish and low-fat dairy. And obviously less often, or at most weekly, are other animal-derived foods. And these sort of recommendations are really part of those diet patterns that we know to be associated with good health, whether it's diet patterns that have been consumed for centuries around the world, like the Mediterranean diet, or whether it's diet patterns that have been created for therapeutic use, such as the dietary approaches to stop hypertension, which, as we all know, was derived from the vegetarian diet, which is known to be associated with a lower blood pressure. But researchers decided to add in small amounts of animal foods, such as lean meats, low-fat dairy, to be more acceptable, in inverted commas, to people living with high blood pressure. And the MIND diet is a combination of the two, used to prevent neurodegenerative changes, and again been shown to have better outcomes for brain health. And then there's country-based sort of diets like the Nordic diet, there's Asian and African diets, vegetarian and vegan, and whole food plant-based, that we're all familiar with, that really rely on all of these green aspects of the pyramid. And again, at the top of the year, we had this big publication from the Nurses' Health Study and the Health Professionals Follow-Up Study looking at diet patterns and their impact on total and cause-specific mortality. So that's the risk of dying from any condition or specifically from cardiovascular disease, cancer or respiratory diseases. And the study included more than 130,000 men and women that have been now followed for over 30 years. And they analysed the food frequency questionnaire data, which is collected every 4 years, and scored the diet patterns based around scoring systems, including the Mediterranean diet and the alternate healthy eating index, and also the plant-based dietary index, which I've talked about lots on this webinar series before, but if you haven't heard of the plant-based dietary index, then there is an article on our website. And basically any of these healthy diet patterns were shown to be associated with a lower risk of dying from all these different causes over that 30-year period. And in general, the risk reduction was in the order of about 20%. And basically, the authors conclude that all these diet patterns encourage high consumption of healthy plant foods. And further sort of clarification of this comes from the annual report from the it's called the US News and World Report, who bring together about 14 different experts to rate different diet patterns. And for 6 years in a row, the Mediterranean diet has come out top, not only because it is centered around healthy plant foods, but because the allowance of all other animal-derived foods seems to be more acceptable and sustainable, certainly to those that are scoring the diets in terms of their ability to promote health and also, as I say, sustainability and acceptability. But I think I showed you this last year. It's worth noting that researchers from Israel have tried to improve upon the Mediterranean diet with the so-called Green Med diet, and it won't surprise you that the Green Med diet has more plant-based foods, particularly leafy greens, has included green tea and also duckweed, and contains much less in the way of red meat and poultry. And no surprise, we've got a string of publications here showing that when compared to the traditional Mediterranean diet, the Green Med diet is better for cardiometabolic risk factors, for fatty liver disease, and also has benefits for the gut microbiome. And another large analysis published in the last couple of years looked at specific foods that were impacting life expectancy. So this used a large data set from the Global Burden of Disease study and modelled what would happen if all the participants from that study shifted from the typical Western diet to an optimal diet, which was modelled around the Eat Lancet Planetary Health Plate, so 85% plant-based and centred around fruits, vegetables, whole grains, beans, nuts and seeds. And what they showed was that if you were going to move from a Western diet to this optimal diet at age 20, you could gain around 10 to 13 years of extra life. And even if you switched at the age of 60, you could gain extra 2 to 3 years of healthy life expectancy. But what they showed was the greatest gains to be made were consuming more whole grains, legumes, nuts, and particularly less red and processed meat. So very much in line with the current recommendations. And what's really nice to see in the last year or so is that there's really been endorsement of a healthy plant-based diet for non-white populations, because a lot of these studies come from white populations, you know, UK and US and Australia. But we've got here data from the Masala study, which, if you remember, the principal investigator also presented on this webinar series. And what they've done is in these 735 South Asian participants living in the US now, they looked at their diet quality and scored it based on the plant-based dietary index, which gives high scores to all plant-based foods and negative scores to all animal foods and also processed foods, whether they be animal or plant-based. And what they showed was that in the participants who were most adherent to a healthy plant-based diet, that they had significantly lower body weight, body mass index, lower cholesterol and less visceral fat. And for every incremental 5-unit increase in the healthy plant-based diet index score, participants had significantly less likelihood of fatty liver, obesity, and type 2 diabetes. This is particularly important in the South Asian population, who in general have a more than 2 times risk of developing cardiovascular disease and type 2 diabetes, and generally this arises 10 years sooner than comparable white populations. And previous studies, I've seen one going back to 2007, shows that actually a lot of this excess risk is due to modifiable risk factors such as diet and physical activity. Similarly, our friend and colleague Kim Williams in the US has conducted an intervention study in African Americans. This was a faith-based church group who went into a short-lived study, 5 weeks, of having home-delivered whole food plant-based meals. But just in that short period of time, there were significant improvements in cardiometabolic risk factors, such that if you extrapolated this as a long-term outcome, you could eliminate around 20% of the increased risk that's associated with the Afro-Caribbean racial disparities in cardiovascular outcomes. So just showing that, you know, despite these disparities in health outcomes, we can have a big impact by changing diet and obviously other lifestyle factors. I like this study a lot, and I show it a lot because it helps us answer this question about, you know, are vegan diets nutrient deficient? Well, the simple answer is no, and it's no different from other diet patterns. You just need to be aware of nutrients that may be of lower frequency or amounts in plant-based foods, and know about those that are favorably high. So this study brought together 141 studies in a systematic review comparing nutritional inadequacy and adequacy in 3 diet patterns: vegan, vegetarian, and meat eaters. And you can see, just eyeballing this table that you can analyze later at your leisure, that there's various nutrients that are inadequate in all 3 diet patterns, and then there's nutrients that are favorable in all 3 diet patterns. You just need to be aware. And of course, we know that vitamin B12 is non-negotiable, and vegans in general need to get this from supplements, if not from fortified foods. So there's no difference really. And the authors conclude that because plant-based diets are better for health and the environment, our public health strategies should support citizens to transition to a healthy, adequately balanced plant-based diet. And of course, you know, we can't talk about human health without talking about planetary health. The WHO have stated that climate change is the biggest threat to human health at the moment, and there are no healthy people on an unhealthy planet. And again, I like this paper that came out at the end of last year, because it looks at individual meal choices, and it analysed 13 different meals and looked at 33 different ingredients. And they looked at a meat version, a vegetarian version, a vegan version, and also uniquely they looked at a whole food vegan version as well. So it's 13 meals, but I'm showing you the picture from the lasagna, and you can see that you know, there's a stepwise beneficial impact on all aspects of environmental health. So this was a life cycle analysis, so basically from farm to fork. And overall, vegan meals, and particularly the whole food vegan meals, had the most benefits for environmental health. And meat-based diets in general had a 14 times higher environmental impact when you take account of all aspects of food production and distribution. So hopefully I've convinced you that we know where we're at with nutrition and health consensus. And actually, this is embedded in all our guidelines already. So I show this a lot. American College of Lifestyle Medicine recommends an eating plan that's predominantly based around a minimally processed fruits, vegetables, whole grains, beans, nuts, and seeds, what we all know as a whole food plant-based diet. And it's nicely depicted here: half fruits and vegetables, a quarter plant protein, a quarter whole grains, mainly water for thirst, lots of herbs and spices. And what you do around the edges comes down to choice, but there is no need for anything else in a well-planned plant-based diet. We've got here the latest consensus statement from the American Society for Preventative Cardiology. And I pretty much copied the recommendation, so this isn't my rewording, but they state that health professionals should recommend a plant-predominant diet centered around fruits, vegetables, whole grains, legumes, nuts, seeds, and they do continue to include fatty fish, but they go on to say that these recommendations can be met by all sorts of healthy diet patterns, including an exclusively plant-based diet. They rightly warn against an animal-based low-carb diet or a keto diet that increases consumption of animal-based fats and protein, because we know the long-term data show increased risks of early death, cardiovascular disease, and cancer. At the moment, there's insufficient data to support a low-carb plant-based diet as a general recommendation, and I'll come back to that in a little bit. And this statement is quite nice because it includes the importance of pediatric nutrition, because we understand that some of our commonest chronic conditions, such as atherosclerosis, even insulin resistance, and certain cancers, really start in childhood to then become apparent as we get older. And they also note that we need to address the negative impact of socioeconomic and racial disparities in health outcomes, and diet needs to be addressed in these communities with poor health outcomes. Dietary prevention of atherosclerosis, very similar. All the green foods we're going to be well familiar with. There is inclusion of fish and low-fat dairy, particularly pointing out yogurt, which we know is beneficial because of the live bacteria and can obviously be replaced by other fermented plant-based foods like kimchi, sauerkraut, tempeh, water kefir, and so forth. And less often is the lean meats, cheese and eggs, and probably best avoided, although they do make an allowance for the small amounts in the diet of refined grains, red meat, saturated fat, and processed meats. We've got a very similar statement from a number of organisations that came together on behalf of the American College of Lifestyle Medicine to make recommendations about dietary interventions to treat type 2 diabetes with a goal of achieving remission, which should be the goal of any treatment pathway chosen for somebody with a new diagnosis of type 2 diabetes. And again, they recommend a whole food plant-based diet, minimizing or avoiding animal foods, refined foods, and ultra-processed foods. Our friends in New Zealand, which we have members, including Mark Craig, have really been championing inclusion of whole food plant-based within their guidelines, and this latest weight loss management guideline includes a new recommendation this year that whole food plant-based diets are a sustainable method for gaining a healthy weight, so obtaining a healthy weight, and it acknowledges that there are benefits of all sorts of plant-based diets, including a vegan and whole food plant-based diet for cardiovascular disease and its risk factors, and for reducing the risk of type 2 diabetes. And in my specialty of cancer, we've known for a while that the basic recommendations for diet are to enjoy a healthy whole food plant-based diet. So they talk about a plant-based diet, minimizing, avoiding red and processed meat and processed foods in general. And what's also very good to see is that there's endorsement of the fact that our dietary choices impact our mental health outcomes, and particularly mood. And the largest body of evidence really supports a role for dietary intervention and lifestyle intervention for depression. In the UK, the NICE guidelines are now stating that physical activity should be prescribed for people with mild to moderate depression in advance of medication. But if you haven't seen the resources from Food and Mood Centre in Australia, they're really great. There's resources for physicians, clinicians, and patients, but they've brought out the first lifestyle medicine recommendations alongside the Australasian Society of Lifestyle Medicine. And here are their dietary recommendations: nutrient dense, minimally processed. They recommend Mediterranean, but when you look at increased consumption of fruit, vegetables, legumes, whole grains, nuts, seeds, herbs, and spices. It's all the healthy plant foods, because we understand that these plant foods promote better gut health, and that then also has a favourable impact on mental health and functioning. Country-based guidelines for a little while have caught up with this evidence as well. 2019, we had the Eat Lancet Planetary Health Diet, which is 85% plant-based. The Canadian dietary guidelines are very much plant-based. They recommend that in this quarter, only half, so an eighth can be from animal source food, but the majority of it should really be plant-based, removing dairy is a food group and putting water for thirst. And these are the latest ones I've seen from Denmark, which is 2021, eat plant-rich, varied and not too much. And then the UK have brought out a couple of documents this year that are well worth reading. They sort of endorse the One Health approach, which is this medical understanding that we can't think about our individual health without thinking about the health of our lived environment and all the animals we share this planet with, because that brings into the narrative the consequences of antibiotic resistance, future pandemic risk, etc. And thinking about the One Health approach, they've got a statement on climate and healthy eating, and putting some of their statements together, they conclude that the foods most damaging to our health are those that are also damaging the planet, and therefore a diet rich in plant foods has significant benefits for individual and planetary health. And this latest guideline also states that some individuals may choose to limit consumption of animal products, and they make it clear that it is possible to get your nutrients from a varied plant-based diet. So that's gratifying to see. Everyone complains that doctors and nurses and other allied health professionals don't receive any nutrition training. Well, actually, it has been included in outcomes for medical graduates for at least since 2018, and maybe even before then. So the General Medical Council clearly acknowledge the role of diet in our overall health and the role in prevention, and require graduates to understand how to counsel patients about adopting a healthy diet. And then in October 2021, there's actually a curriculum for nutrition for medical schools. And I guess with all advances, it takes time to embed within the very busy curricula. But I think some of this has made it more possible for organisations like ourselves to contribute to this education. And as you know, Hayley Tate is teaching a whole food plant-based module in 3 UK universities this year, and that's been really well received. And this is a curriculum for sustainable healthcare. And of course, we can't have sustainable healthcare without thinking about prevention and also the aspects of diet and food choices. And so it clearly states that food is medicine and that we need to use healthy dietary approaches to prevent most of our chronic conditions. And it states that a plant-based diet has benefits for individual and planetary health. So another good endorsement within curricula. And just again, well, I mean, the date is just the 1st of February, so it's just very recently been published, an editorial that I have to say I never thought I would see in a very credible medical journal, the American Journal of Cardiology, that health professionals are coming together to write that it's now a moral imperative for medical professionals to promote a plant-based diet. Not only is it beneficial for individual health, it's essential for planetary health. And, under the One Health approach, we have to think about our fellow animals when we're making our diet choices. So what are the remaining areas of controversy? Well, I think there's a few areas that we need more research, although at the moment there doesn't seem to be major concerns when we're thinking about brain health, but we just don't have enough data. So I think there's always been a concern that a diet that avoids fish, and therefore the main source of long-chain omega-3 fatty acids in most diet patterns, is going to be detrimental for brain health. But from the small amount of data that we do have, and this again was published last year, there doesn't seem to be a negative consequence, but there may in fact be a benefit. So in this study from Taiwan, those on a meat-free diet had about a third of a reduced risk of developing dementia compared to comparable meat eaters. And of course, we have to remember that these Taiwanese Buddhists who are part of this prospective study, they tend to have higher intakes of fruit and vegetable and soya foods than we do in the UK, and they do also avoid tobacco and alcohol. So it may be a general healthier lifestyle and better diet quality, but it's good to see that there doesn't appear to be a detriment. But I think we need to learn more about the nutrients that optimize brain health and healthy brain aging, and we look forward to a webinar from Eleanor Holmes on omega-3 fatty acids and the latest research on that. And another area of concern is bone health, now that we've had 3 consecutive studies over about 2 to 3 years that have demonstrated, or at least reported, an association between meat-free diets and an increased risk of bone fractures. And obviously there's nuance in the data, and I do have an up-to-date article on our website if you want to learn more about the individual studies. But in general, this seems to be a concern only in females with lower BMI. So that's a body mass index of less than 22. So still within normal range, but there does seem to be a sort of linear relationship between low BMI up to sort of 22. And in these populations, they were not always achieving adequate vitamin D, vitamin B12, protein and calcium requirements. And so, for example, in the Adventist Health study, they showed that in the group that were in fact receiving adequate calcium and vitamin D intake, there was no longer an increased risk of fractures. And obviously we have to take into account the impact of a more processed vegan diet, which I think is of relevance to the more recent study that was reported from Leeds. It was a UK women's cohort. And of course, you know, bone health is more than just about diet. It's also important to emphasize the importance of weight bearing and resistance exercise. And there's been a small study showing that in vegans who do adequate strength building activities, that actually there's no detriment in bone health markers. Another area that is always a topic of contention, certainly in the hospital setting, is about adequacy of protein and source of protein in older people, and is animal protein required for prevention of sarcopenia or frailty in general. I think what's clear is that you know, you probably do need to increase protein intake with age, but I think what's also become apparent is that you're probably better to do that from protein coming from plant sources. So this study, large study of over 85,000 women in the Nurses' Health Study, aged 60 years, followed for 22 years. And they had a large proportion of people who were diagnosed with frailty based on the Frail score, and I've listed the 5 criteria of the Frail score at the bottom. But they essentially showed that a higher consumption of plant protein reduced the risk of frailty, where the opposite was true. Higher animal protein intake increased the risk of frailty. And there was a dose response. So for every 5% of animal protein that was swapped instead for plant protein, that significantly reduced the risk of frailty going forward, and that there were benefits for removing both dairy and non-dairy animal source protein from the diet. So I think that's really reassuring, but I think it would be nice to have more studies in this space. The other area that gets confused, and a lot of hot debate certainly on social media, is about the optimal macronutrient combination. And as much as I might turn up my nose at precision nutrition, I do think this is an area where you know, your choice of macronutrient combinations or percentage can be personalized to what feels right for you. And this will differ at different stages of life. So nutrient or macronutrient requirements differ based on age, medical condition, level of activity. So for example, children need higher intakes of fat than adults. Athletes may want to increase their protein intake for muscle building, strength building. And in kidney failure, you know, to slow the progression, you might want to have a low protein diet. And this is typified by the 5 different diet patterns in the 5 blue zones where people live the longest, healthiest lives. And I poached this from Brenda Davis's website, but it's from the original National Geographic source, that you can see that the macronutrient combinations are quite varied when it comes to carbohydrate and fat. Protein is relatively stable, but basically health outcomes are very similar. And virtually every randomized study I've seen in terms of different macronutrient combinations hasn't really shown a major benefit of one over the other in a large scale way. So I think you can decide what works well for you. And David Jenkins in Toronto, he's sort of pioneered the low carb vegan diet, which is called the Eco Atkins diet, where carbohydrates are limited to around 25% of energy intake, and there's been an increase in plant-derived sources of fat and protein. And so here there's been a randomized study of a low-carb vegan diet versus a lacto-ovo vegetarian diet, where the carbohydrate intake was around 55 to 60%. Now, I do wish they'd done a low-carb vegan versus a higher carb vegan rather than a vegetarian, but there must have been a reason for this. But basically they showed equivalent sort of outcomes when it came to weight loss and insulin sensitivity and cardiovascular disease risk factors. So there didn't seem to be one way of achieving weight loss and diabetes control when it came to the macronutrient combinations. The only kind of positive finding that they reported was that clearly, you know, a vegan diet compared to lacto-ovo was going to be more sustainable for the planet. I think that's of no surprise. So for me, I think there's 3 areas to look out for in the coming few years are further research on the microbiome and its impact on both physical and mental health, precision nutrition that I do roll my eyes at, but I think we're going to be seeing more in this space, and then some more research on the newer plant-based meat alternatives or alternate proteins or plant-based proteins, whatever you want to call them. And so just some examples of what we know and where we're at. I mean, I'm obviously been interested in the impact of the microbiome on cancer outcomes. So we've known for a while that a healthy gut microbiome can be associated with a lower risk of cancer, and that's sort of likely to be due to a healthier immune system that's being able to achieve its role of sort of immune surveillance and prevent cancer cells from developing into established tumours. But in the recent years, there's been quite a lot of positive data in different settings showing how a healthier gut microbiome is associated with a better response to anti-cancer treatments and also a longer remission, and that the healthier gut microbiome in participants in studies are associated with the consumption of higher fiber plant-rich diets, which then result in higher levels of short-chain fatty acids and the sort of hypothesized knock-on benefits to the immune system. And I love this paper. I show this a lot. It's worth looking up if you haven't seen it. That is the title of the paper. And I do believe that this is what oncologists should know. And I mean, there's all sorts of fancy interventions you can make to improve your gut health, you know, from fecal transplant to sorting bacteria or probiotics, prebiotics, you know, that are pre-made for you. But actually, there's some simple dietary interventions that they point out. And this is including Tim Spector as one of the authors. Ideally eat a variety of plant foods, 30 or more different species per week, emphasize polyphenol rich foods, or those dark colored fruits and vegetables, increase dietary fiber, and add a daily dose of fermented foods to your diet. The other area that really is having a lot of money chucked into it is precision nutrition. So the NIH has just awarded, well, a year ago, awarded £170 million for research in precision nutrition. There's obviously quite a lot going on in the UK in this field. And the basic assumptions are that generic nutrition advice is not working. I mean, we can discuss that perhaps, and that our bodies are unique, and so is the food that we need to eat. And some of this narrative comes from the PREDICT studies that I'm sure you've seen data from. This is a study between the US and the UK, and it stands for Personalised Responses to Dietary Composition. And the initial study reported back in 2020. I seem to have lost my screen. Anyway, I hope I'm still sharing. Can you just confirm you can still hear me, Rahini? Oh yeah, okay. So
yes, can you hear perfectly.
The PREDICT study, partly run by Tim Spector and his Zoe team in the UK, but also collaborating with Stanford and the Mayo Clinic, included more than 1,000 participants who were brought into the kind of clinical area for a whole day. And amongst these participants, there were identical twins and non-identical twins as well. And they were all fed various meals, and their responses to these meals, so the postprandial responses in glucose and insulin resistance and their microbiome and triglycerides, were all tested. And basically they showed that there was an up to a 10-fold variation in responses to these biomarkers to the same meal for different people. And this included differences between identical twins. So they surmised that you couldn't explain this by genetic variation alone. And they hypothesized, based on these data, that we would be best to minimize these unfavorable postprandial responses. So as I say, they mentioned glucose, insulin, triglyceride, gut microbiome, because if we eat the wrong foods, in inverted commas, for our biology, this will lead to dietary inflammation, more hunger, adverse effects on the gut microbiome. And if it's repeated constantly over months, we'll develop these diseases that are associated with inflammation and these adverse health outcomes. So what's being proposed is that individuals who, because we respond differently to the same foods, that dietary advice should be focused on minimizing dietary inflammation by tailoring our dietary advice. So on a similar theme, we've had a sort of precision nutrition study that's just literally been reported that included 242 adults with tissue-specific insulin resistance. So they included people who either had insulin resistance of the muscle or insulin resistance of the liver. And they did this through sort of metabolic profiling. And also oral glucose tolerance test. And then they divided them into two groups for 12 weeks of either a low-fat, high-protein, high-fiber diet, or a high-fiber diet, sorry, a high-fat diet with high monounsaturated fatty acids, so lots of olive oils and olives and stuff. And after 12 weeks, they were able to show that the improvements in insulin resistance really did depend on their sort of insulin resistance phenotype. So those with muscle insulin resistance responded better to a high fiber, low fat diet, and those with liver insulin resistance responded better to a high-fat diet. So they conclude that precision nutrition based on insulin-resistant phenotype may enhance diet-induced health improvements. And it's worth saying that these improvements occurred in the absence of weight loss. So it wasn't because these people lost more weight. So it's something that's independent of weight. And then I think finally, there's a lot of money being put into research into supposed alternate plant proteins. So there's been a big collaboration that I noticed between Beyond Meat and the American Cancer Society. I mean, somehow doesn't seem quite ethical, but nonetheless, I think there's acknowledgement that we need to move to more plant sources of protein for improving human and planetary health. We don't have many studies on these newer PBMAs, and the ones that have been conducted do show benefits compared to at least red meat. You know, we need to do more research basically into these newer products and alternate proteins. So in conclusion, I hope I've convinced you that plant predominant or plant exclusive diets are associated with excellent health outcomes. Variety of plant foods is always going to be key. Bone health does require special attention, and we need to be mindful of that. There's definitely co-benefits for planetary health of adopting a healthy plant-based diet, and that these recommendations for a plant-based diet have been incorporated widely into country-based and disease-specific guidelines. So just in parting, just to remind you that I run this online course at the University of Winchester. It's a certification with 30 hours of CPD. Next round will commence in March. And a reminder of my two textbooks, one co-authored with my sister and the other co-edited with my sister and Lisa Simon, our plant-based health professionals dietitian. So thanks very much. I think that's me done.
That was fantastic. Thank you so much, Shireen. I think you probably covered a lot of the questions that people had on this topic within the presentation, but there are a few, so I'm going to kick off with those. So there's a question about potatoes, which obviously comes up quite a lot, and why they're so high up in the pyramid. Is it because of the way that they're usually consumed, or are there any other theories for why that might be the case? Do you have any ideas on that?
Yeah, as you say, a really common question when showing these kind of diagrams or pictorial representation of healthy foods. So I think just to say that, yeah, I think somebody's pointed out that, most of the data that we've got from observational studies clearly come from, diet patterns that really eat mostly white potatoes. With sweet potatoes, if you think of the blue zones, Okinawa, the traditional Okinawa diet, 70% of energy from purple sweet potatoes. But I think in answer to Rajiv's question, the Nurses' Health Study and the Health Professional follow-up study with this 30 years of data have consistently shown, regardless of preparation methods, that higher consumption of white potato per se is associated with high rates of carrying excess weight, high blood pressure and type 2 diabetes. And the Harvard School of Public Health have been really influential in a lot of the guidance that's out there, including the Lancet Planetary Health Plate, which is why that section and that a healthy eating plate is so small for starchy veg. Now, having said that, in the UK, we've got quite different recommendations on starch-based foods. And Rahini, correct me if I'm wrong, but I mean, it's recommended that at least a third of calories come from starchy foods, which would include potatoes. But I do think it comes down to variety. 70% of the world's calories come from 4 crops, of which potato is one of them. And I think, as part of a varied diet, I don't see an issue with potatoes. I think the issue is with a really narrow diet where people are limiting food choices to 6 or 7 or 8 different plant species, which we know is not enough. But yes, I think the Western approach of eating potatoes that are fried with salt and sugar-based tomato ketchup or whatever is probably not helping these trends. Other country-based studies, such as from Spain, have not shown these similar sort of reproducible data. So I think it's a perspective, and I wouldn't want to say potatoes are good or bad. I think it can be eaten as part of a healthy plant-based diet.
When they're looking at that data, are they including potatoes eaten with the skin, or are they potatoes that are?
Yeah, I'm not sure if there's that granularity with the skin, to be honest. I don't know. I've not seen that specifically stated.
Yeah, it's interesting. Definitely on a personal level, I love potatoes. They're such a low fat, lower calorie, but still nutrient dense food that make a plant-based diet far more satiating. So actually can be a great for weight management. But as you said, it's that diversity and getting that in. But I don't think one has to, if you enjoy potatoes that are baked or boiled or steamed, and certainly if you refrigerate them and then consume them, either by reheating them after refrigeration or eating them cold in a potato salad, obviously without mayonnaise or something like that, or even vegan mayonnaise, you massively lower the glycemic index. So potentially could keep yourself fuller for longer. You're getting in more resistant starch. So that could be a good tactic if you find that potatoes make you hungry, or you just notice that anecdotally. I think that could be a good tip for anyone listening. What are your thoughts about, you mentioned obviously omega-3 and taking a supplement versus getting it? What would you say in terms of a practical takeaway for people listening?
Difficult, and I would alert you to our upcoming webinar on the topic, where I'm sure we will learn lots and be brought up to date. But I mean, I think my summation of the evidence so far is we don't have a black and white answer to this question, and we have to be open to changing our view. I think the way things are currently, the precautionary approach for people over the age of 50 at least would be to take an algae-based supplement. We obviously know that for pregnancy and lactation, supplementation is essential, and you can find more details about that on our fact sheets on the website. I think for younger people, the jury is out, and I don't know if we have a right or wrong answer. Rahini, have you got a view?
I think that they can be very expensive, the algae-derived omega-3. So again, I would focus first and foremost on getting the sources of ALA that, maybe a mix of ground chia and flax, a couple of tablespoons or something throughout the day, or a tablespoon on your porridge. That's what I would suggest first and foremost. But if you are someone of reproductive age, or you're planning a pregnancy or breastfeeding, or you're looking after small infants or children, then I would definitely recommend taking the DHA EPA. But we're going to have the webinar, I think, in May. So that's going to be, a really hot topic that keeps coming up again. So that's going to be up on the website soon. So definitely tune into that one. And there's a question here from Lucy on, what do you think about the precision nutrition idea as being rather elitist? Should we be focusing research on giving more general advice, given that it's difficult to get people to follow general guidelines, let alone personalized diets? As you already said, if we the Eat Well plate is we're largely on the same page, but we're not following it.
Yeah, I totally agree. And I think it's not going to be the answer to improving diet quality equally across all populations, all people in society, or countries. That's not realistic. So it's really applicable to, as you say, a very niche sector in the population. But for whatever reason, it's captivated the imagination of researchers and grant-giving bodies, and it's nice to think, well, it's not our fault that the diets aren't working for us. It must be something innate in our bodies, and we need it personalized. I agree. I think our money would be much better spent on the preventative aspects of implementing the dietary recommendations that we know, role modeling and public sector catering, all those things that we know would benefit from some extra resource, because we're so far away from what I've described in the kind of healthy plates and pyramids. And we know that just any shift towards that would be beneficial without having to spend that extra money on, continuous glucose monitoring and microbiome testing. I agree. I think it's for a very elite few, and I can't say I'm enamored by that trend, but I think it will be interesting from a science and intellectual sort of viewpoint, but I don't think it's going to change any advice anytime soon.
Totally agree with that. There's an interesting question actually about cultural foods and where can we find data on Asian plants? We've been talking about diversity of plants throughout. What about foods like Karela or bitter gourd and tinder, okra? And these are obviously so many foods that are found in the Asian subcontinent or even other parts of the world. What class do these belong to? Should we be eating broccoli regardless?
Oh, yeah, that's a difficult question. I need your help with that, Rahini. I mean, I haven't seen specific, I think I've seen most studies on sort of wide variety of different grains, like, millet and the sorghums and things like that, where, it's a widely sort of easily grown, climate resistant type of grain. And obviously we're in the year of the millet. But I haven't seen specific information on those different types of kind of cultural vegetables. I mean, I think certain groups of fruits and vegetables or certain families, like you mentioned, broccoli, part of the cruciferous. So I think it will always be important to include those because of what we know happens and the metabolic pathways and the beneficial phytonutrients that are created. So I don't think it takes away from that. But, I think I suspect
there's always going to be more research, the same way that there's more research on white Western populations than there are on other groups. It's going to be similar when it comes to foods as well. So I think if you're buying imported broccoli that's flown halfway across the world, maybe you're paying 4 times the cost than what you can find in your own local environment, then maybe think twice and actually go for foods that are grown, maybe greens that are local, that are going to be fresher, and having that variety in. I don't think you have to seek out this one specific superfood like quinoa or broccoli, unless it's something that's actually accessible to you, because certainly we know, there's thousands of types of greens in China, and not just bok choy, but there's such a huge variety. I know that from when I lived in Singapore, and I think it's the same in India. So it's just finding what is actually accessible to you, affordable to you. Getting that variety in is what I would recommend more than just trying to find maybe broccoli or one other food that you have read a lot about. But if you want to seek it out, then that's always good. I just do you kind of agree with that, Shireen? It's seeing what's accessible.
Yeah, I think so. And I think it will always come down to variety in general rather than specific individual foods, although specific research has been done on certain families of plant species. So yeah, I think variety definitely, and I don't see a reason why any of these other foods are not going to be equally healthful if they're accessible to you.
Sorry, I just had a bit of a cough. One of the questions that came up is, a lot of times I see that studies put all vegetable oils together in their analyses. In your opinion, is there a difference in health benefit, between olive oil and sunflower oil?
Yeah, good question. And I think the data supporting at least extra virgin olive oil with, the benefits of the positive sort of omega-3 ratios and also the polyphenols, they really do seem to sort of that oil does seem to be higher up in the pecking order, but it's always about instead of what, so it really depends what it's being compared to. So all plant sources of oils, except for those high in saturated fats, so the tropical oils, are going to be better than animal sources of fat. And then I think there is a hierarchy amongst the plant-based oils with things like rapeseed oil and omega-3 and extra virgin olive oil coming out top. So there does seem to be something special about the olive oil, whether it's just because it's been researched more, whether it's funded by the olive oil companies more readily, but the positive outcomes are sort of quite numerous in the data. Oh, you're muted.
Sorry, there's a comment here saying, great presentation, Shireen, very useful. Did you happen to come across any new insights for practitioners, how people could be helped that are on a strict whole food plant-based diet, focused on low calorie density foods and still don't lose enough weight?
Oh, so not losing weight on a whole food plant-based diet. Yeah, I mean, that's tricky. And I suspect, Rahini, you have more sort of lived experience of supporting people in that space. I think that is where sort of mixing it up with your macronutrient combinations can be of use, because there are certain groups of people who respond better to low in carbohydrates and some that respond better to a higher fat, higher protein, satiation may be different based on how much protein you're eating. So I think there are these differences that have been picked up amongst certain people. It's difficult to sort of extrapolate and make general statements, but I think that's where I would go. And then, as minimally processed as possible. Some people report, really avoiding kind of flour-based foods and so I haven't got any magic tips, but of course everyone does. A lot of people struggle with weight despite being on a plant-based diet, and there can be these adaptations that can be made.
Totally. And then you can add in extras like circadian rhythm eating or intermittent fasting, resistance training, which should anyway be done to kind of minimize muscle wastage and maximize fat loss. All of that can really help. And I think working with a health professional can also help guide you, because so often it can be overestimating how many calories are sometimes burned through exercise and other things and underestimating calorie intake. So having someone external look at that. But if that's not affordable to you, then something like a MyFitnessPal or a chronometer to at least track a few days and see what your overall kind of intake looks like. Although, of course, diet is one part of the picture, and maybe looking at some of the other areas of lifestyle as well. If you're sleeping 5 hours a day or you're not moving very much at all of that contributes, although of course food is still the biggest area, but all of those add up. And of course it's not you can be doing one area sort of as well as possible, but you might be losing sight of some other areas that could really help you shift the needle.
Yeah, I think just to add to that, it reminded me that the Forsyth report back in foresight report back in sort of 2007, looking at, contributors to obesity, sort of looked at, found 100 different factors that are related to our, eventual body weight, of which a lot are not related to just what we eat. So as you say, mental health and well-being, socioeconomic factors, all those sort of things. So it does require a more sort of open approach.
100%, and looking beyond just BMI at so many other measurements of well-being, quality of life, other health parameters for sure. Completely agree. I think there was one little question left. Does the typical soya yogurt that's found in supermarkets count as a fermented food that would promote gut health?
Some of them do have live bacteria, so I think you just have to check whether they do have live cultures in it. It usually tells you. I don't think all soya yogurts will be, but what do you think, Rahini?
I think that the ones that have lactobacillus on the back or mention it will. I think like Sohade, the French brand, and Alpro Soya in the UK, they both seem to have added cultures, and then Oatly, and probably if you guys, obviously Oatly is not soy yogurt. And if you're making soy yogurt at home, obviously it's not going to have the added calcium most likely, but you can add in extra cultures and things, and then probably getting in other sources through sauerkraut, kimchi, other cultural fermented foods like dosa and idli, or injera, which is the fermented teff bread in Ethiopia. There's so many different other fermented foods, even things like pickles and sourdough. If you enjoy the flavor and you want to include it in your diet, then I certainly don't see a harm in that, providing some of them tend to be a bit higher in salt, so you might want to limit the saltier options out there. And right, okay, there's still some more questions coming in, but I think that we've covered these all because it's all about omega-3 and everything else. But thank you so much for the lovely comments. I think the chat may have not been working halfway through, but it should be working now. But thank you for the lovely comments, and to Shireen for covering such a big area. I know this is going to go up in our members area as a recording, because we had lots of people who wanted to join this evening who weren't able to, but hopefully if you enjoyed it, tell everyone else about it, or watch it on catch up if you want to soak up the information again. And thank you very much everyone for joining. Good evening.
Thanks everyone.
Good night.